Welcome back to Virginia This Morning. This Partners in Healthcare segment is sponsored by Crater Community Hospice.
Discovering a work-life balance while taking on the care of an ill or aging parent can be possible with support. November is National Hospice Month, and Brenda Mitchell and Krista Ratliff with Crater Community Hospice join us this morning. Welcome, ladies.
Good morning. Good morning.
Nice to be here. Thanks for coming in. I want to start with the basics. I think when you've experienced hospice care, you're very familiar with what it is, but for those who are not familiar, tell us what it's all about.
Well, hospice care is a way of providing not only medical care, nursing care, psychosocial care, but just overall support to a family who's dealing with a serious illness, usually in the home setting. And our goal is to help that family work through that process in a way that the family member is able to die with dignity and comfort in the way that they choose to die, usually in the setting where they want to be, which is in most cases their private home, or it could be in the nursing home or assisted living facility. And occasionally it's in the hospital, but in most cases it is outside of an acute care setting.
It's an incredibly challenging time for families and people who are going through this. How do they find themselves in transition into this place? How do they know that it's time and call in hospice care help?
Well, one of the things that we try very hard with hospice is to make people aware of hospice early, before they even need to be thinking about will they be needing it. And this is one of the ways of us doing this today, is to make more people aware of hospice and hospice services that can be helpful to them. So hopefully if people are aware that there is a service, that when they begin to think about end-of-life care planning, that's something that they will think in terms of, that's the way I would like my end of life to be, but also it's a way of remembering when they are diagnosed with a illness, terminal illness, that they can begin to look at that as an option.
So it is possible then to start exploring this long before you may find yourself in a place where you need it.
Definitely.
We encourage people to look at medical directives and to do some advanced planning and communicate with their loved ones about what they want at the end of their life, what kind of care and what kind of medical interventions they may or may not want. Our referrals really come frequently from the physicians, but we also get them directly from the families, calling and asking for information and allow us to have a dialogue with them about what our services are. And we have a nurse that will go out and talk with the families and meet the patient and continue with that conversation to decide if it's the right decision for them.
And you're part of a really great network, Partners in Healthcare, as well.
Definitely. We're very pleased to say that we were one of the founding partners when it was identified that this was something that was needed in the community. Our community liaison, Bill Humphreys, was one of those who we talked about this and identified that this was something that was really needed, and you know, I was very pleased to be able to support that process so that we could be one of the founding partners and getting Partners in Healthcare up and going. And it's really been a large transition from about 4 different organizations have come together, and now we have such a large group, and it's really providing a wonderful service.
Well, it's fantastic to have that resource in place, and thanks for sharing your information this morning too. Appreciate it. Crater Community Hospice, one of the Partners in Healthcare, 3916 South Crater Road in Petersburg. Give them a call, 526-4300, or visit online, cratercommunityhospice.org.